Is it any coincidence, or was it by design that you have this fancy wound healing center here beside diabetes? I know they treat a lot of diabetic wounds. What's it like knowing that you have a place that's right beside you that you can refer to someone if they're having diabetic problems with wounds?
Yeah, I mean, the merging of our diabetes center and our wound center was a great idea, because it just made sense. Because we see a lot of the same patients they have, and they see a lot of the same patients we have. And what we've found actually since we've merged is that we weren't actually seeing the patients. There were patients that they were seeing that needed our help, but for some reason they were not connected up with us until they came to the wound center. So now we've got this great relationship with the wound center where if they've got a patient who has uncontrolled blood sugars and has a diabetic wound, they'll see them there, but then they bring them right over to us, and we get them set up. And then the beauty is when we know that they're coming in for an appointment, we can make their appointment at the same time here at the diabetes center, so they're not making multiple visits to accomplish everything they need. And vice versa. I had a client, a type 1 diabetic, who I was looking at putting on an insulin pump, and he happened to mention that he had a sore on his foot that was taking weeks to heal. And I immediately brought him over to the wound center, and sure enough, they've gotten him set up with visits with the doctor over there. The one thing that I hear from clients who've had diabetes for a while, who never went and got education initially when they were first diagnosed, when they finally come here, they always say to me, "I wish I had come here sooner." So I think the most important thing is when someone is diagnosed and has just received that first diagnosis of diabetes, I think the normal reaction is to maybe ignore it or deny it or just go on living. But we find that people who educate themselves, and sooner rather than later, have much more success of living that long, healthy life with diabetes. I hear people come in with terrible thoughts of the horror stories of diabetes. They know someone who's gone blind. They know someone who's lost their kidneys. And the sad thing is that doesn't have to happen. If you get the education and you learn to manage the disease early on, those things aren't going to happen.